Hey, ladies and gentlemen, this is Bertram Lancico, and welcome to the Roundup. Wow, we are here. It is October 4th at 12 noon Eastern Standard Time, and I am so excited for each and every one of you. If you may not know or be too familiar with who I am, my name is Bertram Lancico. I've been involved in HIM, RCM, staffing, recruiting, placing, and building companies for over 10 years. I started off with somebody with no experience, actually wanted to get into recruiting. It happened to be in revenue cycle. I got an opportunity and I was a peak performer within 6 months. One of the things that really helped me stand out from my peers, also the competition, is my utilization of social media. But a lot of people got it twisted. They thought, well, Bertrand was just like a social media recruiter. I did a lot more than social media. I was calling people, right? I was emailing, I was, aggressive to go to shows and conferences and do whatever I could to be a peak performer because my back was against the wall and I had my shot, I had my opportunity. So I definitely relate to a lot of folks that may be more entry level, just getting started, but we're here on the roundup. Now, my presentation just loaded, so let me go ahead and let's add that to the stage. And I'm really excited for who we're going to have today. One note I do want to mention, because a lot of folks are having issues. So when you see the roundup and it's 12, right, you have to enter into the event. Okay, think of it like you're at a conference but you're listening from outside. It's going to be on your wall, and that's you right now at the door, so you can hear us and you can probably even try to comment. But a lot of people last roundup, they couldn't comment, or they didn't see their face, or they couldn't really interact because they're interacting on their wall. So if you have just joined and you're like, well, Bertram, I see you and all of this stuff, I want to say hey, I want to say hello, I want to greet everybody, fantastic, I want to network, I want to see what jobs and opportunities, I want to be a part of this roundup, you need to click inside of the event. Or if you're part of our roundup email list, that link is in the event as well. You're going to get that link and you want to go into the link and you want to make sure that you're on there. And just to make sure that everything is working, why don't you go ahead and give us a little shout out, give us a hello, tell us where you're from. The speaker that we're going to have here today, Tara, and myself, we're both in Florida, and we were just talking about the weather and how it's hazy outside. So if that's you, that's absolutely fine, but let us know where you're from. That is to really make sure that it's working on your side. Because if you see where you commented, it shows LinkedIn user or it shows your picture, it means you may not necessarily be in the event. This is also being dual streamed on YouTube. So for some reason, YouTube is usually fine. I don't really have a lot of followers on YouTube for some reason, but on LinkedIn, very active, all of that stuff. So, you're going to be able to see that. But just comment to make sure that everything is working. Say hello to the crowd, and let's go ahead and get started. So why are we here today? We are here today as a bi-weekly webinar for now on LinkedIn Live, where employers, employees, recruiters, subject matter experts, and also vendors. Yes, we are welcoming vendors. If you sell a course, if you sell one-on-one tutoring, resume building service, something that can service our industry, we want to hear about it. We want to hear from you. We want to know that that is available. Well, Bertram, if all of these people are going to reach out, how does this make it so much different than LinkedIn or what I already see? First of all, not everybody's going to do everything, meaning they may see this and they're probably going to say, no, it's not for me. I know the last roundup that we had close to 100 people attend. Okay. But also I want people to know who the movers and shakers are. Also, I want to give a chance, as I am a small business owner, I want to give a chance to other small business owners to share their services and for them to be able to get out, because we are somewhat competing. But what if I could actually bring a vendor to you and have like a discount code for the first time that you happen to use their service? Wouldn't that be of some value? So we're just here to share value, and this is absolutely free. So, if you could share with your network, share with people. I know we have a lot of people that have, even as soon as we created the event, right? I'll usually create the next one the day or two after, and they already tell their network like, hey, it's in 2 weeks, but I'm going to attend. And a lot of folks have reached out to me privately and said, Bertram, I'd love for this to be weekly. I'd love to get an update as to who's hiring, what jobs and opportunities, hear from different subject matter experts. I have more than 50 topics and people that I can bring to the table in all different facets of revenue cycle. The big thing and the big resource for this roundup as well is revenue cycle is gigantic. Coding is in the middle, right? It's definitely a very integral part, but we have the front end, we have the back end. We also have the practice management side as the people that are helping the physicians, the patients, and all of this stuff go through the revenue cycle. And what if it's garbage in, right? Garbage in equals what? Garbage out. So all of this is important. But right now, especially a lot of the spend for a lot of hospitals tends to be revenue cycle. So revenue cycle, especially coding. So that's where the focus is. But there's so much that you can do. A lot of folks reach out to me, well, Birch, I want to get started in coding. I want to do this. And my initial thought is that is fantastic. But what if they happen to not know all the other things that they could have done? You know, when I got started in recruiting, yes, I wanted to be a recruiter, but I didn't know that would lead me to lead a recruiting team, to be part of building companies, to then be part of have my own agency and doing that across the board, to now doing this on the roundup. You know, we're still doing staffing, we're still doing recruiting, everything's fantastic, but you have to start the journey to see where that's going to lead you. It can't just always be A to B to C. You can jump levels and you can do so many different things. You can get involved in legal and risk and all of that stuff. So that's why we're here today. You know, for me, this is a labor of love. And a lot of folks have said, well, Bertram, if you're spending your time, your money, your resources to help people get hired, why are you doing this? And I had a very deep conversation with our speaker, Tara, yesterday. And from a mentor of mine, I realized what it is. Now, for each and every one of us, we were in a situation that was rather traumatic. Okay. And I'm talking about like you didn't have a parent in your life. For me, I didn't have my father in my life. My father was a multimillionaire. He did very well business wise, but in his personal life, it was totally opposite, right? He had a lot of things going on. I respect him, you know, let him rest in peace. But he passed when I was around 12 years old and I didn't get the chance to know him. Very traumatic for myself, right? I'm close to 40 years old, very traumatic for myself. But a lot of us may take that as, well, you didn't have a father in your life. How are you going to know how to be a fantastic and great dad? Or we can take it the other way. Why, since I know that is so traumatic, how can I change and be different, not only for my kids, but from my industry or to represent, just as people will see? A lot of folks think that it is for me and not for others. And let me explain this in a different way. Okay. Anyone that has done great things, let's say Michael Jordan, right? Let's say Martin Luther King, right? Imagine Martin Luther King saying he had that I believe, like, you know, I had a dream speech. And he's like, I have a dream speech. And you know what? I'm just not feeling it today. I'm just not going to give that speech. Imagine how many lives would have changed. Imagine how our government would have changed. Would we have had our first African American president? Okay, like, you have to realize that sometimes for you to do something, you have to be the first to do it. Okay. And I know within our industry, we have a lot of folks that are very siloed. We have a lot of folks that don't happen to know what other jobs and opportunities they have within revenue cycle. I know we have a lot of folks that are itching and trying their best to get their first 3 years of experience because everybody's giving them the catch 22. Hey, you need a job, but to get a job, you need experience. But how are you going to get a job if you can't get experience? I did a search on Indeed yesterday. Hey, let me see if I can bring some more value to the roundup. Let me search for entry level medical coding positions. I did the search and I wanted nationally, like, hey, show me whatever we have. It's like, hey, we have over 2,000 jobs entry level. Fantastic. And I looked through the job descriptions, 5 to 8 years of experience. I'm like, what? This is not entry level. This is exactly what we don't need. I mean, they have all the resources, all the money, and they can get us that list, but they can't do that. And what I realized is maybe since it was such a hard time for me, it took me over 3 years of rejection for a job that nobody did want to be a recruiter, right? And maybe I need to be the person to help people get those jobs because it was so traumatic to me and I knew how it felt. Essentially, I think in our journey to self-actualization, Maslow's theory, a hierarchy of needs, all of that, you can Google that in your free time. I think as we mature and as we get to a certain point professionally, we realize that, you know what, maybe it's not just me being the best that I can be. Maybe I need to be the best that I can for others. And you know what? If we are able to establish great things and do great things, once again, Michael Jordan, Martin Luther King, that can set a precedent or that can set a benchmark for all other things. For those of you that are religious of the Christian faith, what if Jesus said, you know what, there's not another person that walked on water, so I'm not going to walk on water? There has to be the first. Somebody has to do it. And you know what's crazy? As soon as somebody does it, everybody else does it. Okay. I heard a story, not too sure if this is true, but Davis Bannister was the first person to break a mile running or sprinting, whatever, under 4 minutes. And the crazy thing is, After he did it, everyone realized that it was possible. We had even high school students breaking the 4 minute mile. I think the year after he broke the 4 minute mile, like 2,000 people broke the 4 minute mile. Everybody knew that it was possible. So please, when you get an opportunity, when you hear something, when you get an invitation to something, and maybe it's not for you, maybe it's not the right time, maybe you're not into dealing with that recruiter or whatever, but please don't just think about yourself, think about your industry, think about your network. You know what? Send those jobs to me. Say, hey, you know what? I'm not looking for a job as an inpatient coder, but Bertram is always looking for jobs and opportunities. He wants to share it with hundreds of people that come to these roundups. Hundreds more view the replays. Can I share it with Bertram so he can share on the roundup? You have to realize sometimes when you get that winning ticket and you're not interested in that opportunity or that day at Disney, that you can hand that off to somebody else. So I think that we need to definitely think a little bit less about self and more about how we can help the whole community and the people that we're parting. So that's why we're doing this. We're doing this to help people. And it's not just entry level. Okay. You can be, an inpatient coder for 10 years and you can be stuck because you want to be an auditor, but nobody's giving you that auditor opportunity. How can you get there? So I believe the same rules apply, but also we can be a service and we can help you. Okay. So I want to go to the comments really quick. Angela, thank you so much. Bertram, we need you. I need you because you know what? If it wasn't for you and if you weren't here, I'll be by myself. so it's all good. Tanji, thank you for joining. She said it's been painfully discouraging to click on jobs and seeing that they need experience. I tell you. We have a LinkedIn user that says, here, thank you for the comment. Entry level should not be 5+ years in coding. And this person, I'm wondering, are we connected? Because if we're not connected, you should definitely send me a connection request. And do not view this on your wall, ladies and gentlemen. Make sure you're clicking into the link and you are, you're participating and you're there. They're trying to get more people on these lives to network and to get benefit from it. So for that, they're showing it on your wall, but you're going to show up like this if you may not necessarily be in, or when we happen to not be, a connection. So Jennifer, good morning, good afternoon. We have LaShanta. Also, she says that she's in Florida and she loves revenue cycle and her niche is denials. You are a very important person right now. We have Catherine Rose. Thank you so much. We connected a few weeks ago. Hey, we have someone from Illinois and another person from Illinois, Essence from Georgia. We have another person from Illinois in Chicago, Chi-Town. What's up? And Stacy from Denver. Wow, we have someone from the VA. Sarah, thank you so much for joining. All the way from California. Wow, crazy. Kentucky, Philly. I can go on and on. The comments are there, but I really appreciate each and every one of you. If somebody can give me a head count as to where we're at, because that's very important for the next slide that we're going to go to. So our mission and the reason why we're here is we are trying our best to help 100 people get hired. As I said, it's not just about me. It's not about me being here and being a talking piece for an hour. I can do that easily, but I would much rather serve, and that's why we're here. So our mission is to help 100 people get hired. So if you've gotten some tips, some resources, you saw a job opportunity on here that you applied, or maybe you met somebody that was a hiring manager and employer, and between the two of you just working, being first introduced here, you're able to provide some value, maybe get hired, that would be so fantastic. Okay, so just share with us. And we do have one person that was hired so far. That person, I'm looking for them to be a speaker and to share with you what they've learned and how they're going to use that, not just for this current opportunity, but the following opportunity. They just started their new position on Monday, on the 2nd. So we're going to let that person get going, get started, and then we'll go from there. So, sorry. The challenge is for us to get to 250 live attendees. Last roundup, we had 93. Fantastic. But once achieved, I think we can definitely get to doing these weekly. Because at that time, we're going to have enough people that are interested in regularly attending. So we can go ahead and get those speakers to have them come in and have them share their best practices with each and every one of you. So that is the roundup challenge. So yeah, share with your team, share with people that you know. I'm looking for like my first like all employee hands-on meeting. Like, hey, let's just meet on the roundup, almost like a lunch and learn, and those kinds of things. And remember, this doesn't have to be associated with any associations. Whether you're on the HEMA side or the APC side, or a small organization, case management on the nursing side, that's absolutely fine. You can be a part of these roundups that we're having. Okay. Lonnie from Alaska. Wow, that time difference is crazy, but thank you for joining. Okay. And what I love about everybody joining right now is you don't necessarily need to have your video on. You definitely don't need your mic. You can just be in the comments. So, makes it much easier, less barriers of entry for each and every one of you to participate. Okay. All right, so today we're going to learn more about practice management and the inner workings of physician practices. Very important because I definitely know that there's a big push for a lot more health systems to own small practices, or even my doctor's office. I mean, it was like a small practice. They were doing fantastic, but then the largest um, health system in our area, owns 12 hospitals in our area, bought them out. So they're buying all of these health systems, but still they need help. And there's a lot of things that they can do. Also, what about the chiropractor's office, right? What about some of these smaller providers that may not necessarily be the best desirable target for some of these niches? How can they get the support? So Tara's going to help us understand all of that good stuff. We're definitely going to share jobs and opportunities. I'm going to have a vendor spotlight. I want to get some vendors on here to share with you, whether it's education or whatever the case may be, something that they can provide value. And also if they can provide a discount code as, hey, you happen to watch the roundup, so here's a discount for using our services because you found about us from the roundup, that'll be fantastic. So that's a new thing that we're doing, as well as resume hiring and getting hired questions live. I have a couple, but of course, if I may not have something that I'm able to answer, definitely feel free to hit me up offline in my DMs or send me an email, whatever it is. Just connect with me and we can definitely be able to help or assist you. Also, the candidate showcase. So that's a big thing that we started ever since we started the roundup. So I'm going to share with you the format here in a minute, but that showcase is for you to tell us, tell employers, tell recruiters, hey, I am looking for an opportunity. So I'm going to have that format on the next slide. And of course, we're going to have open networking at the end. Okay, fantastic. So I have it here, and the format for the candidate showcase. Now, last roundup, I think we missed a few people. Not of our intention, but I think it just happened. And I would prefer, okay, you can do it anytime you want, but I would prefer you not to comment with your candidate showcase profile just yet. We're gonna have that after we have our speaker and a little bit later. Reason being is because I would like to get the candidate showcase to be at one specific time. And if we can have, or if I can have even recruiters in my network say, hey, recruiters, if you're looking for coders, the candidate showcase started at the 34th minute. So go ahead and click on that and review the candidates, see who's available for an opportunity, who you're looking for, and they can reach out to you. But if you, let's say, put your information now, they could see it or they might miss it. So I'd prefer you to do that a little bit later. But for you to prep and get that started while me and the speaker and we're all learning more about practice management, I did go ahead and I put that in the comments. So try not to fill that out now. You definitely can if you have to run, but try to save that to a little bit later. So let's jump into learning a lot more about our speaker. So Tara, I met her a few months ago. We've been working together off and on ever since. And Tara, I believe it is Lallier, so it's more French, right? If I could say that correctly. But she's a former certified medical billing specialist, and she brings over 25 years of healthcare experience to the roundup. She specializes in general practice management, workflow solutions, hematology, oncology, coding, and a lot more. And of course, her passion would be in hematology, oncology, and patient advocacy. So her journey from a billing supervisor, this is what it's all about. It's showing you that it's very possible to just be doing something like a billing supervisor to now managing and helping practices all over the country. And in 2021, she started her own venture. This is Zion Medical Coding and Consulting. She has a website. We're going to have her contact information at the end. So I would like to introduce and bring Tara to the stage. Tara, how are you doing today?
Hi, I'm doing well. Thank you.
Wow, thank you for coming to the roundup. And welcome.
Thank you.
So, I would love for us to, when we connected and I was like, hey, we're working on something not related to practice management. Okay. And, it's more about like, what is practice management? So, Tara, you're renowned for practice management and helping physician practices like get their stuff in order,
Yeah.
not just revenue cycle, it can be a lot more than that. But what is practice management?
You know, it's a laundry list.
Mhm,
Basically, a practice manager comes in and she is the Jane of all trades within the practice. She is the owner and or the doctor's right hand person.
mhm,
And of course, it really depends. The role depends on whether you're hospital based or whether you're independent based. I choose to go with more of the independent base because it's just more of a family environment.
mhm,
But basically, you have to be effective at day to day operations. Well, what does that include? I mean, that includes making sure your compliance plans are put together and they're adhered to, making sure the revenue cycle is on point, your cash flow is coming in,
mhm,
making sure that you're meeting with the vendors and you have good relationships with them in case something happens. You can call them and, you know, they'll make sure everything gets fixed properly. Of course, human resources. So,
mm,
taking those 5 a.m. calls and then shifting the schedules around as needed and making sure payroll is done on time, making sure people have PTO coverage.
mm,
And the biggest thing I always like to say is as a practice manager, you have to be open to learning and to leading.
mm,
You have to go into it knowing that you're not always the smartest person in the room.
mhm,
So, um, you know, that's how I learned. I learned from a lot of other people, and I think that's sometimes where we get it wrong. We go in thinking we know everything, and we don't.
yeah,
Um,
absolutely, absolutely.
so,
So you started, more on the billing side, right? You even became certified in billing. So
mhm.
how did your journey take you from billing to essentially being able to lead and manage practices?
Gosh, it was just a series of stepping stones,
Mhm,
and actually, when I started out, somebody did. We talk about someone taking a chance
mhm,
on someone, may not have any experience, maybe completely green behind the ears. And my very first job, actually, before I even got to the billing part, I was 19 years old. Someone took a chance on me and hired me in a GI office, gastroenterology, 7 doctors scheduling colonoscopies.
mhm.
And from there, I learned everything that I could. And from there, it evolved. And then,
Nice.
usually the last landing place is usually the billing because where else do you go from there?
Mhm,
Um, and I think that, when people say get your foot in the door, that's what they're talking about. They're talking about getting your foot into a medical practice or something within the healthcare because the more you learn about the flow of the office, the better biller and the better coder you will be. Just
mm,
because the person before you, how their job affects you, and then how your job affects the next person. If you don't understand that cycle, it's called revenue cycle for a reason. If you don't
correct.
understand that cycle, you're not doing anybody any justice within that role.
So
So
I've never thought about it like that because you're mentioning starting from a simple position like a billing position helped you a lot because you're able to go through the steps, almost like learn all of the positions, right? Learn what everything was doing and everyone's doing. So when you got the opportunity to be a leader, you were able to affect change not only at that level, but all the levels before because you felt all the pain points before.
yep, yep.
Wow.
And when I jumped into a billing supervisory role,
Hmm.
again, I was very young because I was given the opportunity. And actually, I went, it's kind of funny. I don't know that this happens so much these days, but I'm showing my age a little bit. Um, I went to the interview and they hired me on the spot.
Okay.
20 something year old billing supervisor. I come in and I'm now having to contend with people that have been in the billing department for a lot of years that had a lot more experience than I did.
Hmm.
So, and that's why I say you need to make sure that you are always open to learning from your
Hmm.
staff because they knew more than me and I knew it. And I was very intimidated by it.
Mm.
But I had to humble myself and go, okay, show me what you guys, show me your knowledge, and they were willing to guide me on that journey. And I without that, I wouldn't have been able to move forward from that. So
Fantastic.
I always tell people every stepping stone is another journey upward into you, wherever you want to be.
Yeah.
You
Yep.
know? So
Absolutely. Absolutely. I think also what what a lot of managers or directors, I'm talking more from the director level, what they've realized is sometimes it's not best to hire the most tenured person on the team to do the job because they may be very limited within their thinking. You know, it's very hard to do something different when you've always done it one way. So a lot of companies directors will bring in somebody that's very junior or is just from
mhm,
an outsider, somebody that's going to ask questions, and whenever they are approached with, well, we've always done it this way, right? They may not always be the best answer. Yeah,
right.
there's reasons why we've done it this way, but has technology evolved or can we do it a little bit differently that we don't have to do it this way or we're doing things twice? That way it's just much easier. So perhaps in them bringing you on board was able to help them affect change. And that boss that probably hired you didn't have to be the bad person because you know the decisions, you know, you're working together but it's not all on them, it's really on you and what you see as being the best thing. So you know it's also a very strategic thing that a lot of companies will do. They'll bring in somebody a little bit more junior, maybe a little bit more green. You know, they can learn how they do things, how we do things, but it can be very helpful to have them think outside the box or bring some of their experience and how they've done things. And I think that's what's really awesome about consulting. It's like a lot of folks will reach out to me and say, hey Birch, we need to do this, and I would ask them where they're at, and I realize like they're step maybe 2 but they haven't even got to step 10. You know, there's a whole process of
Right.
getting there. So that's also, you know, what a lot of the experience brings. So
Mhm.
one of the things that I remember in trying my best to help smaller practices and physician practices is that a lot of times they are thinking that they can do everything. You know, technology can do a lot of things. Like, you know, you can have EMR that can schedule, you can bill, you can do a lot of these things. But then they had like this particular client had quite a bit of denials, and reviewing their payer requirements, for example, they had denials that were past the denial rebuttal date. You know, it was like, hey, you need to be done within 180 days or whatever. And it's like, it's way past that. So it's like, I'm even thinking, well, what are you doing? You know, it's time to drop those because even if you correct everything and you resubmit it, and then a lot of times there were pay discrepancies. Try my best to help them. You know, got them the right person, and we were ready to go. We just needed a contract and a set budget so we can go ahead and get started. And they just couldn't get out of their own way. You know, it was a
Yes.
husband and wife team, and you know the other, not the physician, but the other spouse was
Mhm.
doing all of the back office. And I'm like, well, first, you don't have somebody that's certified in doing this. Two, it's you're having an issue, and that's why we're talking. So why can't we help you? Like almost like help us help you. What is your say on that? Like, is it smart for a physician practice to perhaps reach out to you, consult with you, or have an audit, something like that, just to make sure that their inner workings are going okay? They don't you don't necessarily need to they don't necessarily need to give you like everything, but what are your thoughts on that?
Oh, I have so many thoughts on that. I've actually I worked a very long time for a husband and wife team.
Hmm.
And it was very difficult at first. But you know, I was able to kind of turn things around. But as far as, yes, please, if you own a practice and you're a very small practice and it's like like you have family working there, you need somebody auditing, regardless whether it's your books, whether it's your billing and coding, looking at your compliance plan, because chances are they don't have the experience or the know-how to do that. It's a checks and balance, and it's the risk assessment, and you need to have that
Mm,
nowadays. And I understand, you know, when they're small offices, a lot of them don't have the larger overhead, or they don't have the larger profit to have somebody come in and be able to do that. But it is necessary, and they need to budget for that yearly. That
yeah.
has to be done.
Yep.
And also to review your charts, do a chart audit, have somebody come in and do a chart audit. It's inexpensive compared to what the repercussions could be.
Ooh, so chart audit, you're referring to what is actually on the chart. So you get, you're receiving the patient. Is it just, let's say, name, date of birth,
Mhm.
reviewing at least what you have on that? That's also something that came up when we were helping that client. We need to
Yep.
see what the requirements are, what they're asking for, because that
Mhm.
is going to immediately go to the chart. That's going to support the information going to the payer. Like you need all that information. So something else maybe just be they don't have enough information that she may
Yeah.
have asked, or there may be something that they need to change their processes or update their processes to have
Yeah.
that information so the payers have it,
I
um
mean, and
mhm.
technically you should not really have a coder also doing the billing.
Okay.
It's just not great practice. It does happen a lot, but that's your checks and balance too.
Okay.
So,
Now, a physician may be listening to this and thinking, well, Tara and Bertram, fantastic, but I don't have thousands of dollars to pay for somebody to come in and do an audit, do a chart
mhm.
review, and this. And we were talking yesterday how it can be so affordable to do this on a budget, almost thinking like tax time. We all know that you can do your own taxes. There's a lot of free software out there, but how much more beneficial it is for all of us also having somebody with their license, the CPA, helping us do that. Could it be as easy as reaching out to you or reaching out to a similar service and having something annualized that, hey, we're going to budget a few $100s or 1,000 to do this? That way we can make sure that we're having the checks and balances.
Yeah. Yeah. I would suggest calling around, see what the industry prices are, and then
Mm-hmm.
budget for that. And then when you're ready, you call the company that you want to have come in and do that for you. And some of them will say, okay, we just want half down now, and then we'll get half on the other end. Some might be willing to do payment plans. You just don't know until you get there and you ask. Don't
Correct.
just assume that it's not affordable, because
Correct.
there are plenty of us in this industry that we understand the need for it, but we're human too. We understand that there are financial difficulties within a smaller practice, and we get that. Especially with the Medicare reimbursement and things like that, everything going on
Mm-hmm.
right now. Um, we're very sensitive to that as well. So don't think we're just going to shut you down because you don't have thousands of dollars. That's not the way we work. Some companies
Exactly.
maybe, but the smaller consultants like me and a few other people, like, we're going to listen to you and we'll do it on a case by case basis.
There you go. There you go. Hey, I just saw in the comments, Betty commented here that for the larger clients, or audits, sorry, that she allows her clients to spread payments over time. And
Yep.
that's what it's all about. What I would encourage, you can, maybe you're not a practice owner or physician, but maybe you're an office manager, right? But if you're having denials and if you have money that is sitting at the payers and it's not coming in, not being collected, you need to do your checks and balances and weigh those options. For example, if there's $10,000, it's going to be a lot more than that. But if there's $10,000 at the payer, and to have somebody come in and help you out for a week or even a couple of days is $1,000, you need to kind of like weigh your options, because there's a great risk for a lot of that money being lost. So wouldn't it be better not only to collect that money, but make sure that you're going to have future revenue coming in clean? That's why we talk about revenue cycle. It has to move through, and if things are not moving through, that's when we're having issues, and that's when you're going to have a lot of issues. I look at it a lot like job security. Hey, I'm coming in. Well, sorry, I'm going to bring Tara and her people in to help us to make sure that we are doing things correctly, when they may feel threatened. Like, oh, well, if I bring somebody in to do the billing and coding, like, I'm going to be fired. There's a lot more value that you're bringing to that physician and that practice than just the billing and the coding, right? But guidelines are always changing. I saw something in the comments that guidelines are life, right? Like, we have to
Yeah.
realize that these things are also changing. So do you want to also be the person with your job on the line as the office manager submitting the wrong guidelines, or working on the wrong guidelines, submitting the wrong codes? Things update all the time. So yeah,
Yeah, and
there's
to your point, Bertram, I just, as an example, so I had a practice call me, and they said, this insurance company, we could have sworn that we're credentialed and we're not. And they keep, one department says we are, one department says we aren't. And so I went in and, looked at everything and went through everything. And I was able to gain them back $25,000 in denied charges because of
Wow.
contracting issues. So it's little things like that that your office does not have time for.
That's true.
Your sole focus is the patient and getting in the correct information,
Correct.
so that you can make that profit. And it took me days calling, and I ended up having to have three-way conversations between the CEO, and like I went all out, but there was so much money on the table, and it's little things like that. That what would you have done if you hadn't called somebody in? You would have left $25,000 sitting on the table.
Correct.
And
Correct.
plus
Correct.
and added revenue for moving forward too.
Yep.
So, make the call, budget it. It's and if nothing is wrong and everything's copacetic, at least you can sleep at night knowing that your staff is doing what they're supposed to be doing and all the rules are being followed.
Absolutely, absolutely. It's funny. I'd almost compare it to, for those who have houses in Florida. So I don't
Mhm.
necessarily pay for pest control services. I go to Lowe's, Home Depot, I get my little stuff. But it's so funny. Every time I don't do my pest control, they're invading the house. And how much easier it would be just for me to, let's say, hey, I pay Terminex or whatever company it is monthly, yearly to come in. They do their little sprays, whatever, and you don't necessarily need to worry about it. That's what it's all about. It's all about you trusting the advisor, because unfortunately, as soon as we don't happen to watch what's going on, that's when things start happening. And unfortunately, with these claims and with how revenue cycle works, it happens in bunches, or you're going to have a ton of money and you're going to be like, wow, $25,000. How did we get here? Well,
Right.
once we had this denial, guess what? They went all the way back. And like, I think it more as job security. Just like we hire that CPA, think about somebody that you can have, even if they're just coming in to make sure that that your team is doing what they're supposed to do. It could be fantastic. A lot of audits also would happen to pinpoint if somebody's not doing things well. Wouldn't that have been fantastic for you to actually go to that provider and say, hey, we found out that this wasn't going on. So we put this person on education track, and whatever, it worked out or it didn't work out.
Yeah,
Doing your
and
best to bring more value.
as far as the audits, everybody gets all up in arms about audits. And I understand because I've been through audits with my old employer in terms of, how some of the corporate entities work. And it's almost like a punishment when you get something wrong. Consultants don't come in like that. We're not looking to punish anybody. We're not looking to,
Mm-hmm.
have you removed from your job. We're looking for education. Where can we educate? Where can we uplift your team to be as successful as possible? And
Mm-hmm.
it's not about telling on somebody. It's, this is what you could have gotten, this is what you did get, and let's go ahead and find out why that is, and let's fix the problem. And now they know, now they're educated moving forward, and now you won't
Correct.
have any more problems. And that's the goal of a consultant.
Correct.
We
Correct.
we want you to be as successful as possible, because that just looks good on us at the end of the day, and it looks
Correct.
good for your profit margin. So
Correct.
we're all in this industry together, and it
Yep.
is a rolling ball always, and it has so many different points that we have to address, and you're not always going to catch every single thing. And having an outsider come in, like you said, with a fresh mind and a fresh take, and has seen different ways other clinics are doing it, that could be a combination of what we could do for you and make it work.
There you
Something that
go.
you might not have thought about. So it's just a good idea, once a year, even just annually, just have us come in and we'll do a follow-up too. Usually that's kind of included in the price, do an audit, we do the summation, and then we should be coming back in a few, maybe a month or two or quarterly, and saying, hey, let me see what you're doing. Let's take a look. Let's see if things are changing. If they're not, then we have to go back to the starting page again.
There
So,
you go. There you go. And if somebody might have a bad experience or a bad taste in their mouth from a consultant or company coming in, person being very bossy, not helping and uplifting, more, demeaning and all of those things, I'll just say then you didn't happen to find the right person to work with. A lot of people are not like that. Of course, Tara's not like that, and that's not the type of person that we're going to bring to the roundup. Have I
no.
run into compliance managers that were that way and almost like felt like a military style and they wanted to like punish folks? Absolutely. But what's funny? I always remembered them, but I remember the nice ones. So when I started my own thing and I needed somebody to help us with coding tests and different kinds of things, who do you think I reached out to? The
Right.
folks that are very helpful. And what's funny? Um, we left the organization that we're working with, and the nice people, they're doing very well professionally because
That's awesome.
everybody remembered them. They showed impact on everybody else. So, it's very okay. Now, what I like to do is I probably want to start us wrapping up, and then I want to go to the comments to see if anybody has any particular questions for you. And then, you know, where do you see practice management, and with all of the M&A action that's going on in healthcare right now, where do you see practice management being as important or not as important in the next 5 to 10 years?
Well, I'll be very honest with you.
Mm-hmm.
If it keeps going where the hospitals are buying up some of these smaller facilities, it may be the role will be changing. That's
Correct.
what I'm going to say. You're not going to have to be the Jane of all trades, Jack of all trades, however you want to put it. You're not going to have to be that person because the hospital will take care of the payroll. They'll take care of the benefits, the
Mm-hmm.
IT. There's little things. So it actually would take a lot off of your plate. However, if we go back to the smaller side, practice managers are the anchor for
Yep.
the entire clinic. So I don't think that role is going to change very much. With the new technology coming out, I think it's going to be a little more of helping to create a more streamlined flow
Mm-hmm.
with the technology that you have. And that's so important because there's so much out there, but how does it help your clinic?
Mm-hmm.
Does it? And is it profitable for you?
Yes.
And if it is, then great. But the roles are going to be changing just a little bit, I think, with that, because you're going to have some things that are going to be completely off your plate. But as far as HR, that's always going to be a thing. People always need time off. People
Yeah.
need to be
Yep. Yep.
paid. People need to be hired, fired, whatever. So that's never going to change. Um, you know, the cash flow, that's never going to change. You're always going to have to be on top of that. Our main goal is basically to create value and stability for the physicians in the clinic.
Yes. Yep.
And that's never going to change.
Yep.
Whether you're
Yep.
a manager, a supervisor, a lead, practice manager, any of those roles, that you have to come in creating value and you
Mm-hmm.
have to come in creating stability because that's your goal.
Fantastic. And I would say I know there's a lot of technology, or there are a lot of threats of technology doing what we would do or people would do, but I'm not necessarily worried about the functions. I think there's a lot of security in the relationships that we're going to have. For
Yeah.
example, a lot of facilities and clients that we have helped, the person that we find out is doing the coding, the billing, whatever. A lot of times they're not credentialed. Also, it's just Sally that's been doing it for the last 40 years.
Yep.
So them hiring or bringing somebody on board to help them helps bring Sally up to par, or maybe give Sally some information that she never really knew that she needed. And
Right.
who's going to train Sally? Who's going to help Sally? We don't want Sally to lose her job. She has a family, grandkids, whatever, right? But who's going to be that person? It's going to be a consultant. It's going to be Tara. It's going to be maybe myself. Like, it's going to be somebody working with that person. It's not going to be technology. Yes,
Yeah.
can they have, let's say, the billing being done somewhere else? Absolutely. But in the relations of working with people, maybe repurposing, retooling people to do other things that just cannot be done elsewhere, is usually done through people. and somebody helping that person get there. So,
Well, yeah. And
give,
as you know, one thing I do want to throw out there that we had talked about and touched on the other day was, as a practice manager, lift your employees up, lift your staff up. If you see someone going over and beyond and you think they can handle certain things, or you want to try to see if they can, throw them a project that you normally have to do, delegate. And if you're only as good as your staff, quite honestly. Um, that's how I was given opportunities. Here, do this. Let me explain it to you. If you have any problems, come back to me and we'll talk through it. But I know, we're not unapproachable as people, practice managers. We're always very busy, but we have to acknowledge that our staff is our backbone as well.
yes.
If our staff isn't running smoothly and they don't understand what they're supposed to be doing, that's a direct reflection on you as a manager.
Correct.
Because it's your job to make sure they are trained. It's your job to make sure that they are uplifted and that they enjoy their job, basically, that they like coming to work every day.
Correct.
So, and you're
Absolutely.
the buffer between them and the doctor. If the doctor's having a bad day, let the doctor yell at you, not his staff. Because if your staff is mad, it's going to reflect now on the patients that are walking. So it's a whole cycle.
Nice. There we go. We brought it full circle. So I think we can go to the comments and answer a few questions. The first one that we have is, hi, Tara, what's your advice for a new CPCA like this person without real experience getting that first job?
Yeah. I'm going to go, I always say it and everybody gets so tired of hearing it, get your foot in the door. Don't be so focused on getting that coding job. Don't get so focused on getting that billing job. Get focused on getting into a clinic and or a hospital system, even if it's just registration, even if, without those registrars, you can't get into the hospital. So, and that is actually the very first part of a revenue cycle is your check-in, your registration. And I think that's the most important part. What you learn, what you need from the patient, how to put them into the system, what the insurances are, do you take them, what's their copay, everything else that's involved with that. Don't limit yourself. I didn't start out in billing. I started out scheduling patients for colonoscopies. I mean, there is, as long as you get into the healthcare and you show that you are willing to learn and to be that person that people can learn from, you will find your path. And you might even go, yeah, I have a CPC, but I like this a lot better. You don't know your path until you get there. So
fantastic.
Don't hyper focus on, yes, you have a CPC and you want to gain that experience. Focus on just getting your foot into the healthcare field and then go from there.
Catherine in the comments commented that she started on the billing side of things and it made her a better rounded off coder, so.
Yes, Catherine. Yes, absolutely.
There you go.
Absolutely.
There you go. Wow.
Yep.
Man. So what I'd like to do right now is I want to get, or at least share, Tara's information with everyone. So if there's something within practice management, maybe you just want to connect with Tara offline. If you haven't already, please send her a connection request. That's why we're here, to network. Tara is connected with a lot of very important people like myself. So being connected with her, you're going to be their second connections, and it makes it a lot much easier for you to get connected with them. When she shares or when she posts something, you'll see it. So that's what all of this networking is, and that's especially how it works very well on social media. So here's her website, here's her LinkedIn, Facebook, phone number, and email. So you have all of the information to reach out to Tara and to get in touch with her. And if there's a question that I wasn't or we weren't able to answer for you specifically, definitely feel free to reach out to her. I want to go in. I saw a comment that Betty shared a little bit earlier. Thank you, Betty, for coming on board. You're adding so much value.
Hi, Betty.
She says that she found that hospitals don't understand how ProfiSide works, I run into a lot of
Mhm.
problems because they try to run the clinic like a hospital. Mic drop right
Good
there.
point. Yep. Yep.
And it doesn't work.
Absolutely.
It doesn't
On
work. It's
point.
not the same.
No,
It's,
no, it's not. No, it's
so,
not. Very great observation. Because that's when the consultants have to come in and now clean up some of that mess. Yeah.
yeah, yeah, yeah.
Yeah.
And
It's
start
rough.
working with the people, not working with corporate. We love corporate. Give us your benefits. Give us all that stuff. But
Right.
like we got
Right.
Sally here. We got to get Sally up to what she's supposed to do. You know, like
Yeah. Poor
we have to work with
Sally.
the staff. And you know, it's
That's right.
funny. You know, as much as I don't want to downplay, you know, folks that work in the office, because guess what? They're dealing with the people. Like when somebody's hurt
Yeah.
and injured and they're coming in, their mind is on billing and the denials, but they're coming in and making sure that that person feels valued and that person feels important. And they're going to be able to see Dr. Mike. You just have to wait a little bit. You know, like we're not trying to downplay what they're doing, but having that person be your patient or client facing person and also hopefully not be stressed out about the back office stuff is what's only going to help your clinic. You know, anytime that we go to the doctor's office, we can feel the energy, right? We don't want that
Yes.
hospital feeling. We want it to feel like, okay, this is a warm place. This is why I came to this office, and you know, they're going to get it taken care of. A very embarrassing thing for any physician practice is that you have to go back and contact your patients because you messed up on your revenue cycle. Oh, we didn't get this, or we didn't have this when the person was there and they actually came with all of their information. You know, I've had those situations happen before.
Oh,
So, you
it
know, just try
happens
your
more
best to
often.
realize that
Yep.
Tara and people like her, consultants like myself, we're here to help you. We're here to make sure that once that patient leaves, that the only thing that they can look forward to is their follow-up or their next year annual visit or appointment. Okay.
Yep.
Wow.
Thank
Tara,
you.
it's been so great to have you on board. You
Yes,
did
thank you.
fantastic. This is one of
Thanks.
Tara's like first times on video, everyone, this large of an audience. So I'd love for everybody to give her a round of applause. And if you haven't already, please send her a connection request. So she's still going to be here, but she's going to be in the back. She's going to be off camera so she can do what she has to do. And we are going to get going. So Tara, thank you again. We'll connect again very soon. Okay.
Thank you, Bertram. Have a great
All right.
day.
Pleasure. Talk to you later.
All right.
Bye-bye. All right. So now we're at the jobs portion. So with the jobs, what we want to do is we want to showcase a few jobs. Now, some of these jobs are new, some of these are not. And the reason why that is because a couple weeks ago, I did share a lot of new jobs, and I was thinking, well, what if somebody didn't miss it? What if this is like their first roundup, right? So I wanted to go ahead and, you know, and get that going. Hey, Tara, if you're still there, you can go ahead, and I see some comments in the comment section, not private chat, but in the comment section. So if you want to go ahead and just comment or reply back to a few folks, just to make sure that they're there. Edwina was on this as well, so I'm not sure if you saw that, but feel free to, you know, comment and interact with the audience in the chat. Okay. So to go through the jobs and what we wanted to showcase in terms of jobs for this roundup, we have these three that I shared last time as well. So Macy Turner's looking for some RCM managers. I believe this is in Irving, Texas. Also, we have a quality improvement coordinator position. We also have a patient access representative position. I need to go through these very fast because we are running out of time. The great thing about this roundup is that it is being recorded, meaning you can go ahead and watch it again, come to this 53rd or so minute and pause it and get who these contacts are. I did get their permission to share these jobs and opportunities, so feel free to reach out to them. Hey, I heard about these jobs from Bertram on the roundup, da-da-da-da-da. So do you, and hopefully it all works out, okay? The next ones that we have Stephen Gore. This is for HCC coders. A lot of folks have reached out and said, Bertram, when can I get these remote coding opportunities? HCC coding is around the corner, and with Stephen, they may not necessarily be entry level. I saw that these are asking for a few years of experience, but you know what? At least one recent year of HCC coding risk adjustment experience. Reach out, see what they have. Maybe they're going to have such a big need. Some of the larger employers in HCC, they have such a large need, they're going to teach you from the ground up. Hopefully, if you only have, let's say, your CCA or your CPCA. So stay in touch with them, stay in touch with the roundup because those jobs are coming. I can't wait for them to be ready. And if I can share email addresses and phone numbers of some of these recruiters so you can reach out to them, it's going to be extremely helpful. Okay. Sarah's in the chat. Go hit her up. We have Shauna. She's looking for some coders and billers. So if you're looking for part-time or full-time work, please send her your resume. We also have Brett. He's a vice president at DaVita. Fantastic thing about Brett is that he shared a couple opportunities and he provided his email address. Where on earth could you find the email address of a vice president on LinkedIn? I found it, reached out to Brett, and I said, hey, I want to share your information. Brett is like, cool, that's fine. And here you go. So if you happen to have something within risk adjustment or within management, within compliance, please reach out to Brett. This is not just for entry level. I know a lot of folks see these things, they're like, hey, well, like it's all entry level stuff. No, this is not entry level. Brett is not just looking for entry level stuff. He's looking for some senior managers. So if you happen to fit that, you have some compliance in value-based care strategy, reach out to him. That might be a great opportunity. Okay. Some new ones that we have from Angela Martinez. She's looking for a quality improvement specialist. Okay. This is a flex position. Office location is Chicago, Albuquerque, Richardson, Tulsa. They do have a few different locations. Reach out to her. We also have Janessa. She's hiring folks for Nationwide Children's. So these are more opportunities. My apologies. The one with Janessa is a little bit small, but as you can see the name there. Feel free to connect with them and see if they may have any opportunities. The great thing about it is what I love about networking and how jobs and opportunities work, it may not necessarily be the opportunity that they have available at this moment. Maybe it's something that they're going to have in the future. But if you're not connected, if you don't happen to know who they are, how are you going to know about those opportunities? So that's why I always encourage people, try your best to be connected and find out who the decision makers are, who the hire managers are, who the recruiters are, because that's where the jobs and opportunities can come from. I heard a quote on Forbes that said, over 65% of jobs and opportunities, especially for those manager, senior, and director level plus and higher, are filled by recruiters. I would say over 90% of jobs within HIM are in revenue cycle are filled by recruiters. Companies need recruiters like myself to come in, find out what they need, go to the market, identify, qualify, test, pre-screen, interview these individuals, and then bring them in, offer them, hire them, have them get started and off to the races. Recruiter utilization in healthcare is huge. So also having a lot of recruiters in your network is going to be a very big help to each and every one of you. Because what do? We have a job. What are we going to do? Keep it to ourselves? No, we want to shout to the whole world, smoke screen, whatever we can do, text to everybody to let people know that they have those jobs and opportunities. Okay. All right. So the vendor spotlight for this week is the Qualified. The Qualified is a women-based group, and what they do is they help folks get their coding certifications education. So for those folks that may be on the fence or they're looking to get their first certifications credentials within HIM and revenue cycle, feel free to reach out to them. We do have a promo code, Roundup Talent, all one word, Roundup Talent. They also have an email address to get certified at the-qualified.com. So if you're looking to get your certification within HIM and you're looking for some folks to help you out, they do have a 10% discount code right here. Feel free to reach out to them. If you are a vendor and you'd like to be featured on the Roundup, I would love for you to also have some type of promotional discount for folks, but we would love to get you featured on the Roundup. Why not? I'd love to just share your information with folks that are going to be on here. Okay, great. So now here we go to the Ask Mr. B section. So this person, for the first question for Ask Mr. B, this person was on our last live and they were stuck on the wall. They were trying to comment, but they couldn't get in. And then they got in and they realized, well, I was just talking on the wall, basically. Okay. Well, Bertram, I realized that when she was searching and when she was looking for somebody like herself, she couldn't find herself. She couldn't, and she also saw that her name didn't show up. So she wanted to know for networking reasons if she is visible and what helps her to be visible. So on the back end of LinkedIn, ladies and gentlemen, there's something called LinkedIn Recruiter. This is where employers and recruiters would actually pay for a service, and for the ones with most premium access, it's very expensive. So it's worth the investment. And it helps us to find and search for people on LinkedIn. Crazy thing about this is that it is highly influenced by your connections. So for example, if I wanted to get involved and started within recruiting revenue cycle and I don't have one revenue cycle contact and I do a search, I'm not going to get as many hits or results based upon somebody who's been in the industry and has a bunch of connections. LinkedIn tends to be heavily favored to those folks with a lot of connections, also those folks with a complete profile, a headshot, or a picture within there. Hopefully it's a headshot. Hopefully it's not just your alma mater, your school, but a professional looking picture and those kinds of things. Reason being, I think they haven't said this, but reason being is because the click rate is higher. So they said this, the click rate is higher, meaning when somebody sees a face and your title and they see that you have your job and career history on there, they're more likely to click to learn more about you. So doing that helps. But I also think LinkedIn doesn't want people with no picture and no connections to come to the top. So what are they going to do? They're usually going to put people that have a lot of connections on the top. It's very interesting because I could search for somebody, and let's say I'm looking for a revenue cycle coder, something, just some risk adjustment coder in Denver, Colorado, and I can do a search, and that person might not show up. But once I connect with a few people or a few of those professionals that's connect with those individuals, they start to show up. So when I was getting started with LinkedIn Recruiter, when I was first using it over 10 years ago, I realized, and they told us that it is highly influenced by the people that you happen to be connected to. So I made it a daily habit to improve and grow my network, and that has just helped out a whole lot. So, try your best to complete your profile. Okay. Two things that people miss out on a lot is the about section. So the about section can definitely be like, hey, I have 25 years experience and I have all of these skills. If you go on my LinkedIn profile, you'll see how I've just blown up the about section. I put in as much information in there as possible as to what I've done, what I'm currently doing, and where we are going. Why would you do that, Bertram? Because LinkedIn is powered by keyword search, meaning the more keywords and the more key things within your industry that you have in there, revenue cycle, health information management, coding, auditing, the credentials, all of that stuff, your education, that's going to allow more people to find you by searching for those things. Okay. So for example, let's say you have your job title right now as medical coder, but some employers may be searching for something, maybe a recruiter that's not related or doesn't know a lot about our industry. They may be searching for a health information technician or a medical records clerk, something like that. So it's much more beneficial for you to have a lot of those keywords somewhat hidden. Or what I used to do is I used to put my job title wasn't recruiter. They were so clever about this. They tried not to give us the title of recruiter because what's going to happen? Because people are going to search for the recruiters from this company and recruit them because they know that they trained us very well. So what they did was they gave us the job title of talent acquisition specialist. Okay. And I knew what they're trying to do. So I said, you know what? That's fine. So on LinkedIn, I had talent acquisition specialist /space recruiter /space healthcare recruiter. You can do that on LinkedIn. You can have a very long title. You want to make sure you have all the titles that are going to cover exactly what you're doing. Let's say it's practice management. Fantastic. Practice manager / office manager. Try to think of as many most relevant job titles so you can be more searchable, findable by recruiters and employers. Bertram, I don't want people to find me. I don't want to be like that. All these recruiters are going to start hounding me. Come on. Remember, it may not necessarily be about you. Maybe it's about people within your network. You can take that recruiter's information, that recruiter's message, and you can share it with your network, or you can share it with me, and I'll share it on the roundup. Remember that sometimes these opportunities are not for you. Sometimes it's for you to help and save somebody else that might need that. Okay? So try your best to make sure that you have your profile, it's professional, and that you have as much information filled out. Fill out your jobs and your career history. Fill out the most common job titles. You can copy and paste a lot of this from your resume, but the key is you need to put that information on there so you can be found for those jobs and opportunities. Okay? All right. Let's go to the next one. Any advice on landing entry-level coding position? And are there any countries who search to higher entry level, trying to get a foot in the door, even though this person has their master's or working on their master's in health administration? What I would say is you have to build your network. I always say this every single time. No, I'm not going to say you need to have your credentials. I'm not going to say you need to get your experience. I always tell people the same thing. You need to have your network. And as you have well, Bertram, I am in Sarasota, Florida, right? We don't really have a big HIM community here. How am I supposed to build my network? First thing I would do is I would search within my direct area. Let's say it's Sarasota, Florida. I'll search out for the medical coders within Sarasota, Florida, as many as I can find. Go on LinkedIn, do a search for medical coder, Sarasota, Florida, enter, and it'll come up 20 people. Every day, I'll try to connect with at least 10 people. In each connection, it usually asks you, do you want to add a note to this? Notes help your connection to accept your connection request. I would say, hey, Bertram, I am an aspiring medical coder. I'm local. I'd love to get connected with you. Just as simple as that. Nothing grimy, nothing like crazy or scary, whatever. Just send it, right? Not Halloween yet. Just send it. You will have most people that will connect with you. And from there, I'll go to Florida, connect with as many people as I can, and then I'll connect with as many people nationally. Then what I'll do this on a daily basis, try to send out 10 requests a day. Then what I'll do is I'll look at the title that I'm going to likely seek within the next 5 years. And then I'll do that locally, regionally, and nationally. Well, Bertram, you're going to have, let's say, 1,000 connections. What's the point of you having all these connections? The point of you having all these connections is that from you having these connections, you are going to be able to see the conferences and the events that they're attending. You're going to see the credentials that they have. You're going to see the things that they post that will teach you what is relevant within that industry. Level 2, you want to start sharing, commenting, and visiting some of these conferences, some of these virtual meetings and such. You want to start participating. You may not have any experience, but guess what? If you are in the barbershop, eventually you're going to get a cut. That's a famous quote by Denzel Washington. What it means is you need to be within the vicinity. Tara told us a little bit earlier, right? How are you going to get started as a medical coder when you're on the outside looking in? Maybe you need to be within the barbershop. Maybe you need to be within the kitchen. And you know what? Once you're in the kitchen, people get sick. Things happen, Oh, our DNFB is like so high. We need to have some extra people coding. Hey, it's Bertram. I've been asking you guys for like 5 years to give me a shot. I'm right here. I'm right here. I'm right here. And you know what? You can even just learn alongside people. Hey, I know we're in a post-COVID environment, but on-site is like where the opportunity is right now. Why? Because everybody wants to be remote. Be willing to go on-site. Be willing to touch people. Be willing to go to that interview with Jeff and I talked about it on the last roundup. Go to that interview with some cookies or a snack or a little fruit tray platter or something from your local Costco or warehouse goods store. Like, go bring in some value more than just what is traditional and what more people are doing. That's how you're going to be renowned. That's how you're going to stand out. And that's how you're going to get the jobs and opportunities. Provide a lot more value than what you're asking for. And something about the universe, something about God, whatever, Buddha, like they're going to take care of you. So I always tell people, yes, there's an online strategy that you can use to get hired from the get-go. But doing these things and participating helps. Also, try your best at least 3 times a week to let your LinkedIn network know that you are searching for an opportunity. That should be it. So I say this all the time. I have a video on YouTube as how I talk, and I encourage people that don't happen to have experience to get themselves and make themselves renowned for jobs and opportunities. So let me try to go and find that. So we are coming to the application, talent application showcase. So I'm going to go ahead. I'm going to reshare the format here in the comments. This is where you can go ahead and let me see if I can find that video real quick. This is where you can go ahead and you can share with us your background and basically what you are looking for. So employer can show it. So hold on. All right. So I have the video as to how you can build and get connected with people online for jobs and opportunities. And I'm going to share that in the comments as well. Okay. So now, ladies and gentlemen and candidates that want to go ahead and showcase themselves, right? And showcase they're available for opportunities, please go ahead and start sharing your information right now. So right now we have somebody that's looking for an entry level in healthcare and medical coding. This person is in Illinois. Here is their certification as well as their email address. So feel free to go ahead and reach out to this person if they may be a good fit for opportunities with your organization. Okay. Okay. I just saw one from a little bit earlier. We have Erica. So Erica is in Louisiana. She has 12 years of experience. She has her CPCA, and this is her email address. All right. Just trying to see if we have any others for the candidate showcase. All right. So for the next roundup, our next roundup is scheduled on the 18th, and that's going to be at 12. Remember, our challenge is to try to get to 250 live views, or at least live attendees, so we can have these done weekly. Also, the roundup mission is to help 100 people get hired. So I'm definitely looking for us to be able to do that and help that many people. Everything that's going to be great and fantastic starts off slow, and that's absolutely fine. But it's been great to speak with each and every one of you. So Catherine chimed in and she said that this was great. She had to run to a meeting, but looking forward to these. Until next time, be safe and be happy. And that's exactly what I would say. We have Sherlyn here, and she says she's looking for an opportunity for outpatient facilities. She's a COC and CPC, 4 years of coding experience. For those folks that might not have had a chance to share their information, just commenting is really big help, because what can recruiters and employers and hiring managers do? They can go to these comments, they can see who you are, they can click on your name, and then they can go to your profile and reach out to you. So hopefully that does generate something for you. Christy is saying that she's also looking for an opportunity in grants and compliance in CME, and this is her LinkedIn. Also, they can click on your name as your contact. That is fantastic. I'm not sure if I got to this person. So looking for an opportunity. They're based in Illinois, but if you can hire remotely from around the country, they'd be fantastic. Alanda, thank you for attending. It was great to have you here as well. We have Stacy. Candidates, I'm wrapping up. So if you want to be part of the showcase, please go ahead and comment with your information, okay? Stacy, she's a billing and coding specialist. She's in Denver, Colorado. So if you'd like to reach out to Stacy for jobs and opportunities, that would be fantastic. All right, we have Divine or John. Looking for a coding opportunity, and this is their email. So thank you so much for attending. Betty, I appreciate you for attending. I know that a lot of folks are going to be at the AHIMA conference next week, or this weekend, I should say, to middle of next week. I'm not going to be in attendance. I'll definitely be there with you in spirit. Perhaps next year, maybe they may even feature us and have us do something like a roundup live. I'd love to do that, but we'll see how that goes. And yeah, we have Alonda. She says that she's in Houston and she has 30 years of experience in revenue cycle. Alonda, I'm not sure if you saw it, but we had that revenue cycle manager position in Irving. I'm not too sure if they can hire remotely or if they may have other opportunities, the power of networking. So I think it was Mary. Mary's the hiring manager, recruiter, HR contact for that opportunity. So feel free to reach out. And I would also say, oh, Alonda, sorry, you're looking for part-time. Part-time, we did have one during the showcase. Let me see if I can go ahead and I can find that slide. I did see it. Here it is. Shauna is looking for a part-time or full-time remote billers and coders. So it's Rami at Rami-MGT or management.com. So hopefully you saw that one. But connect with her, see how you guys and ladies can possibly work together. We have another candidate in Missouri. She's on the Profi side. She's been doing ENT. Here's her email address, looking for a remote opportunity where she can work on her COC as well. So Stacy says she can't make the next roundup, but you'll definitely get more in the future. That's fine. You can always watch the next roundup as it is being recorded. Okay. All right, ladies and gentlemen, I'm gonna go ahead and wrap it up. My last word I would say for for the end of this roundup is it's been fantastic. It's definitely been a journey. I can definitely see the need for this in our industry is needed, but it's definitely really all about timing and as momentum builds. So every time we do one of these, we're having more and more attendees. That is fantastic. right now in our industry, because of AHEMA, a lot of companies have started taking PIP trips. They are already there within location. They're getting things ready. There's a lot of preparation that they have to do for that. So I definitely understand. So if you're on the vendor side and if you're going to be there, definitely represent. You guys are going to have a fantastic show. I definitely believe that. But I think that might have played into some of the attendance or lack of attendance that we had this week. But that's absolutely fine, because guess what? We're still going to be here, and I'm definitely looking to connect with a lot of you after the show. So as I always say, be renowned or be forgotten, and we'll see you guys next time on the Roundup. Have a good one. Bye-bye.